Welcome, everyone, to Breakfast at Tiffany's. I'm Dr. Shari Johnson, and I'm filling in today as a guest host for Reverend Tiffany Williams-Brewer. Today's conversation will be about breast cancer awareness, particularly motivated by Tiffany's current breast cancer diagnosis. It was important to be sure that we used this month to educate our breakfast family by having today's discussion, which I am honored to lead. Joining me today for our conversation are two amazing women. Dr. Marie Wilson, a women's health nurse practitioner who advocates for trauma-informed and patient-centered care, and Ms. Stacy Veneman, a functional and integrative nutrition specialist who helps women heal from the inside out. Together, we'll explore how we can all listen to our bodies, nourish ourselves, and protect our peace. According to the American Cancer Society, more than 316,000 women in the United States will be diagnosed with invasive breast cancer this year. While Black women are often diagnosed at the same rate as white women are, research shows that they face more aggressive forms of the disease and greater challenges accessing timely care. That's why early detection, advocacy, and community support are so essential. Our theme today is whole health, whole safety, protecting our bodies, our voices, and our lives. Invites us to look at wellness through a more complete lens, one that includes prevention, nourishment, and emotional safety. And when we talk about protecting our health, it really starts with awareness, knowing our bodies, noticing changes, and feeling safe enough to ask questions or speak up when something doesn't feel right. And that's where prevention truly begins. So let's start there. Dr. Marie, many women, especially younger ones, still aren't sure when to start screenings or when changes deserve their attention. So from your perspective, what should women be paying attention to? And how can providers create a safe, judgment-free space for those conversations?
Yes. First and foremost, I'm just really honored to be here and to be on this wonderful panel. Thank you for this opportunity. For me, I would say it's important for young women to know yourself. So again, I say awareness is prevention. So it starts with that. So being aware. We can go down the medical field as far as like a screening. So they recommend to start mammograms at the age of 40, and at either 1 to 2 years every year you should start getting your mammogram, but everybody is different. So we do a deep history and assessment to look at your history. We look at your paternal side and your maternal side. Now if you don't know either side, let's just say you were raised only by your dad or just a mother or an aunt or grandmother, you don't have that, try to do as much investigation. But you want to look at your symptoms. In addition to, recently they've made a new change saying at the age of 25 every woman should have a risk assessment done at the very age of 25. So it pertain it sorry it consists of your age, of course, well, 25, obesity, alcohol use. So they look at lifestyle changes, of course, and then your family history. Do you have a close maternal mother or sister or sibling, or even on the other side, who had breast cancer? So then you're given a score. With that score, you're either between high risk, moderate risk, low risk, and then from there, you and your provider can develop a plan. Even though it's recommended by the USPFT that they should start doing it at 40. However, depending where you are in your risk, it may start sooner. In addition to that, let's just say if your mother was diagnosed or your aunt was diagnosed at the age of 40, for you, you have to actually start getting screened 10 years prior. So if it was 40, you're going to start screening at 30. If your mother was diagnosed at the age of 34, you're going to start at 24. So at least 10 years. In addition to that, not only is the mammograms are important, but other imaging are important, like ultrasounds, MRIs, biopsies, and genetic testing. So there's testing like the BRCA1 gene, if you guys have heard about that, the BRCA2 gene, things like that, where you're more at risk. And also, it's not just breast cancer that you also have to investigate as far as your family history, but other cancers such as any type of GYN cancer, such as cervical cancer, um, um, ovarian cancer, any type of GYN cancer, because there is a strong correlation between those GYN cancers that put you at a higher risk for breast cancer. So I know you guys probably heard of Angelina Jolie, who tested positive for the BRCA2 gene, or hers, or you hear of hers negative, a positive, two positive exams, genetic testing. They then are given the choice, or here's your possibility of possibly obtaining cancer. So it is a combined decision between the provider and the patient to say, okay, do I want to do a lumpectomy? Do I want to do a mastectomy? Or let's do some biopsies, things like that. So you want to pay attention not just to breast cancer, but GYN cancers, to see where you are on that risk. And with that, you will start doing earlier testing in addition to imaging. Again, mammograms are not the ones that only diagnose, or at least it's a screening. But then you have diagnostic mammograms in addition to ultrasounds, MRIs, and or biopsies and genetic testing. And oh, and one more thing too, your symptoms. So you want to make sure that you're doing self breast exams every month, in addition to reporting any symptoms. If you have pain, if you feel a lump, if you feel any nodule, and it's not just the breast, it's also the lymph nodes, which is under the armpit. You want to test over there. And that's actually the most common place that it's found. It starts in the armpit, not in the actual breast. So you want to check every month, the same time, see if there's any changes to your physical breast, to see if the skin is changing, if there's any nipple discharge, things like that, different shapes. If your nipple is inverted, those are signs that you want to report so they can do further testing.
Thank you so much, Dr. Wilson.
Mhm.
So many pearls of wisdom in your response. And so, one thing that I just want to emphasize, the first thing you said was awareness. Awareness is prevention. I
Mhm.
think that is so important. One of the things you also said was risk assessment.
Mhm.
So, the best practice is having a risk assessment. And I believe you said at the age of 25 or around the age
Right.
of 25.
Mhm.
And then based on the risk assessment, that determines your risk for um, any of the cancers. And then
Yeah.
that would
What?
determine. Mhm.
Mhm. To
Go
see
ahead.
where do you fall, what
Mhm.
category is it, high risk, moderate risk, low risk, and with that you can make an informed plan, a combined plan with your provider, to see, hey, when am I going to start doing testing, or should I further testing to see where you are.
Thank you so much for
Mhm.
that.
Mhm.
And Stacy, I want to transition from the body to the mind and the holistic part of health. And so I want to talk a little bit about stress. And when women live under chronic stress, whether from fear, overwork, or unsafe environments, how does that affect the body's balance and even risk factors like inflammation or immunity?
So again, first and foremost, I would just like to thank y'all for having me. Tiffany has been a friend for over 30 years, so I am just absolutely blessed and honored that you all would have me come and share some tips and knowledge that hopefully will help many people. So stress, to answer your question, first and foremost, is incredibly damaging, much more so than I believe many people understand. Stress truly is at the root of almost all diseases when we really get down to it. It causes massive cortisol spikes in our body, and then this drives inflammation. It suppresses our immune system. It also disrupts our hormonal balance. It disrupts our sleep and our digestion. And those are three key pillars of our health. So when that starts to crumble, the rest of our body starts to crumble in response. our bodies also hold on to stress. So we may be holding stress or trauma that happened to us as a child, even as an adult. And if we don't take active steps to heal that stress, to heal that trauma, and to release it physically from our bodies can actually become diseased because of it. So, one of the first things I try to do with anyone who comes to me with any type of a cancer or chronic illness is unpack their emotional stability, their childhood, try to see if there's anything that could have triggered a trauma response, or if they lived with chronic abuse or trauma, or things that may have deep-seated roots in their bodies. And so over time, this stress and inflammation really starts to just completely wreak havoc in our systems and can leave us very susceptible to things like cancer.
Thank you so much. So, Stacy, just to recap, you said there were three main areas that stress impacts: the hormonal balance, sleep, and digestion. Is that correct?
Correct. Yes, absolutely. Those are three key pillars
Mhm.
of health.
And so, as we were preparing for this conversation, one story really stood out. A mother recently shared that her young daughter, she was in her 20s, discovered a golf ball sized lump in her breast. Thankfully, it wasn't cancerous, but when they sought advice, they were told to wait until her first mammogram in 20 years. Um, and of course, that did not sit right with either of them. And it's a powerful reminder of how important self advocacy is, even for young women. So, Dr. Wilson, how can young women advocate for themselves when they sense something is wrong, but they're told they're too young for screening or to wait? What are your thoughts?
I would definitely say get a second opinion. No one can tell you about your body more than you. Yes, we understand there's the textbook definition, but remember, all are not created equal. And then when you take a deeper dive when it comes to race, how it appears in me is different than what it appears in Stacy. So we have to look at that. So we have to make sure that we're equitable and inclusive. And we have, again, if you don't feel right and you feel like you're not being heard, then you need to get a second opinion. Providers need to be, empathetic and understand, like, hey, their symptoms are real, because it's not just, okay, I did this, but something is right. From telling you something is wrong and I don't feel right, waiting 20 years, it can morph into something else. I'll give you this quick, I share this story sometimes. Well, I've shared it a couple of times. Um, I'll give you an example of a experience that I had. So this was my second son. I had a C-section the first time. This was my second C-section. And about 8 weeks or so after C-sections, you're kind of cleared for, you're cleared to return to normal activities. So I kept on having these heart palpitations, and I'm like, something is wrong. My incision was healing fine. There was no blood. I wasn't concerned about that, but I felt like something was wrong. So I went to my provider and I said, hey, I don't feel right. I'm having these palpitations. I know my body. I know I was pregnant before I even missed my period. That's how well in tune I am with my body. So she was like, oh no, it's just postpartum. It's just your recovery from the C-section. I said, I had a first C-section. No, it's not. She kept kind of dismissing me, and she knew what type of line of work I was in. So even with that, I saw that she was giving me resistance. And I'm like, what is it to you? I have insurance, like, things like that. Anyway, she said, okay, fine. But her attitude was like, fine. I'm like, I bet you it's not going to be anything. I'm like, I don't care. I want to get testing. She sends me for an MRI. Within a couple of days, she get the results. She calls me over the phone and she said, hey, literally, like, I want you to come in, or it goes, I'm going to send you to a doctor and I want you to go have a consultation with this doctor. He's a colorectal cancer, colorectal physician who specializes in robotic surgery. So I'm like, okay, she doesn't give me much detail. Again, not her area of expertise, but you can hear the uncertainty in her voice, and it didn't sit well with me. She didn't even prep me. I roll up, literally pull up to the place where she sends me, and I won't say the name of the institution, but it says blank cancer institution. I said, I had an entire breakdown in the parking lot crying, call my husband, call my mom. I'm like, oh my God, I have cancer. I have cancer. I think I'm like 30, 31 or something at the time. And I'm crying. I'm like, oh my God. So I go in, see the provider, and he pulls up the imaging on his desktop, and he literally is like tilting his head like, and he literally says like, I don't know what the bleak this is, literally verbatim, don't know what this is, but I don't like it, I don't like where it is, we need to have surgery right away. So between getting prior authorization for my insurance and getting availability in the OR, less than a month I'm on in the OR, have a surgery, and it was a huge pelvic tumor the size of a grapefruit, and it was sitting on in my left pelvic area, and I had this constant dull pain too. In addition to the palpitations, I had this constant dull pain in my lower left pelvic area, and it was sitting on a huge vein that was connected to my vena cava, which connects to your heart, that can cause these palpitations. It just makes sense. So he then have the surgery, and then he said we're going to send it for a biopsy, but he said when it came out it literally looked like the inside of a coconut. It had hair, tooth, it had hair, tooth in it, spilling all these fluids. And thank God it wasn't cancerous, but he said, but it was determined that it was a dermoid cyst. However, it could have morphed into anything. So the provider, literally, I came back and I had my post-op with him, and then I saw her as a follow-up. She apologized repeatedly, saying, I'm so sorry I didn't listen to you. You know, she was like, this was a lesson learned for me, like to listen to my patients. She was also Caucasian, but I trusted her no matter what. She took well good care of me, but this was a lesson learned from her. So that's what I'm saying. Even though their typical textbook, like, oh, this is what postpartum or recovery should look like, or at this age, oh, you're young, you don't have a family history. It's the person's symptoms that they're reporting and how they feel. You cannot tell patients how they feel. Remember, pain and all these symptoms, they're all subjective, and you have to listen to these patients. So I share that story to say, no one's going to advocate for yourself more than you. And if they don't listen, go get another doctor, go to another practice, because it literally can cost you your life. God knows what it could have morphed into later on. So this is now 11 years ago, and who knows what it could have morphed into. So, I share that story to say, if they don't give you the answer that you like, you have the right to advocate for yourself. Knowledge is power, and no one can take that away from you.
That is such a powerful story. And
Mhm.
I thank you so much, Dr. Wilson, for sharing something so personal, but something
Mhm.
that can help others.
Mhm.
And had you not self advocated, to your point, what could have happened? And
Correct.
so, I think it's important for us to just emphasize the importance of that it's okay to
Mhm.
advocate for yourself and to have
Yep.
family and friends with you
That's right.
to help to advocate.
That's right.
And there's nothing wrong with that. There's so many stories. Some have made the headlines, others have not.
Mhm.
Serena Williams, she has
Mhm.
her story has been highly publicized
Mhm.
about her experience.
Mhm.
But there are other untold stories that are happening, every day. And
Mhm.
so I think that this information is so important. And
I
Stacy, for
wanted
that, yeah, oh,
I
go
wanted
ahead.
to add, I just wanted to add another thing too, that people can say when you go to a doctor, when they're saying they don't think it's nothing. And the credit won't go to me. It goes to one of my colleagues. Her name is Valerie Revelis. She's also an NP. She's a psych NP, but she has a certification in maternal perinatal health. And when someone questions you, they're not sure, ask them, so what is your differential diagnosis? What are some of your differential diagnoses? So by law, they're like, oh no. So with that, they have to do testing. They have to give you different diagnosis because based on your symptoms, based on what you're reporting, they then have to do their due diligence to do testing to see, okay, what could the possibilities be based on what I'm reporting in the entire picture. So that's key. What is your differential diagnosis?
And so in layman's terms, for
Mhm.
non-medical
Mhm.
viewers, can you break that down a little bit, Dr. Wilson,
Sure.
in terms of what that means and how someone who may not be in the medical field, how they can go
Mhm.
about still asking those kinds of questions?
So, for instance, if you're saying, "Oh, I think it's a hormonal imbalance," or "I think it's just you're still recovering," so you're saying basically, what else can it be? What other diagnosis can this be? Based on my symptoms, what else can this be? Because I'm telling you that, okay, for instance, say if I'm reporting bleeding, like I have my period, but 10, 12 days after, 14 days after my period, I'm still bleeding. So she's saying, "Oh no, you just have an elongated period." No, what are my differential diagnoses? What else can it be? So then she has to say, "Well, is it cervical cancer? Is it postcoital, which is like after sex you have some bleeding? People can experience that. They have to do their due diligence and to do testing. So with that, cervical cancer would be one of those diagnoses that would, say, okay, red flag, but let me go do testing. Let me do a biopsy. So they have to do that. So it's basically saying, what are the different diagnoses or the other conditions can this be?
Thank you so much.
Mhm.
So going back to the young woman's story that we were talking about previously, Stacy, for that young woman in that kind of a stressful waiting period, what are some ways nutrition and lifestyle choices can help manage anxiety, inflammation, or hormonal balance?
Sure. So the stress of that type of a time period is just tremendous. I'm sure we can all relate to that. So the in our bodies, our emotions are largely regulated by our blood sugar and our nervous system. So what we want to do is try to keep our blood sugar as stable as possible and soothe our nervous system. So we can do this a lot of ways. Blood sugar stability, one of the easiest things that we can do to stabilize our blood sugar and not get when blood sugar rises very quickly after a very sugary eating a sugary food like candy or a donut, it crashes, and that's what causes this roller coaster, and that can affect our emotions. So a way to blunt that is simply to focus on protein and plants. That's what I tell my clients, protein and plants. So it makes it very simple. You have your chicken, your meats, your eggs, your nuts, your peanut butters, your beans and legumes for vegetarians, and your plants, your broccoli, your salads, your asparagus, your peppers, low sugar fruits, blueberries, raspberries, things like that. And then in addition to that, we can also add in some foods and some nutrients that are high in magnesium. Magnesium is very calming to our bodies. So foods that are high in magnesium would be pumpkin seeds, leafy greens, things like that. So I would encourage her also to up her magnesium either with food or with a supplement, and that can also definitely help. And then finally, regulating your nervous system. This would probably be more lifestyle choices. So things like walks in nature are very soothing. I have a client I'm working with right now who has an incredibly high stress job. And we have been working together for months trying to help her reduce that stress, to move away from behaviors that are numbing, such as having a glass of wine or eating foods that are not good for us, to something productive. And the single most effective thing that she has tried to date is a 10 or 15-minute walk outside during her lunch break. It has done absolute wonders for her. So I always encourage my clients, get outside. The sunlight itself is very healing. It has infrared light, which is incredibly helpful for us. So I think walking, prayer walks, some breath work like box breathing is also very effective for calming our nervous system. And journaling. I think journaling is just a great way to get things out. There's a lot of research on the effects of just writing things down, putting them on paper, and it's a type of release. So that's what I would recommend to her in this very tumultuous waiting period.
I love that. Thank you so much, Stacy. And
Sure.
I noticed that I started doing that, taking walks, in the middle of the day, just 15 to 20-minute walks, and especially when the sun is out. And I noticed that does wonders.
Yeah. Fabulous. I do it myself. I take an hour walk, probably mid-afternoon around 3 or 4. It is
Hmm.
sacred time. I block my schedule out. It's in the middle, in there, just like an appointment, and it is sacred to me. It's what I always joke, but it really is what keeps me going. I look forward to that walk like nothing else in my day.
Yes, yes.
Wonderful. If you start to do it and you get in the habit of it, you'll never go back.
Yeah,
That's
yeah.
good. Hmm.
And to schedule it, as part of our schedule. I think that's so important.
Like
So
an
important, because
appointment, like an
otherwise
appointment. Hmm.
you have to make an appointment with yourself. That's what I
Yeah.
did.
Yes. Dr. Wilson, you often talk about trauma-informed care. How do you approach conversations about stress, about abuse, or mental health in a clinical setting, especially when patients may feel a bit guarded or fearful?
Hmm. It's definitely comes down to trust. Of course, doing a thorough assessment or history is important, but you can see sometimes the reluctance to share or open up. So, trust is important. And that's why we do talk about also having culture, being able to deliver culturally competent care. So, you have people who looks like us. It makes a difference on how we establish trust and that they understand them. People with similar backgrounds, religion, I know a lot of times, even myself, I can speak to going to therapy. I want someone who has some type of religious background that can relate to me because I think on a different level. I just don't think like in the black and white. I look at it whole, like I want to make decisions or understand things on a spiritual level in addition to what's going on in front of me, so that helps me to better understand and make decisions. Yes.
I love that. I wish we had
Yes.
more practitioners like you. I do.
Yes. So I
Absolutely.
definitely, because you have more, you establish that trust and then they understand your language, for lack of better words. So if you do have that understanding or you sense that, it's important also to ask permission. So just because, sometimes we have to slow down as providers because we have that, okay, 20 minutes, I need to see the next patient. You have to slow down, take a deep breath before you touch someone. Always ask permission. Just because I'm a woman's health, not everybody feel comfortable. Some people don't even like to touch their own private parts, so let alone a stranger. And and having been a labor and delivery nurse for many years, and I'm like, touch the head or touch this, they're like, oh no, they're so grossed out touching their own private parts. So of course, as a stranger, you need to ask permission because that can reignite some trauma. Say if they are victims of rape and sexual molestation, doing that can trigger some past trauma. So asking permission, slowing down, saying, is it okay? And at any point, you want to let them know, hey, if you feel uncomfortable, let me know and I will stop. If this is too much for you, even the conversation, let me know, I will stop. It's good to sometimes have these conversations with patients alone, especially if they're coming with a partner. But sometimes if they have someone who is supportive, you can have them in the room too to make them feel comfortable. So it's something that you have to gauge and ask questions. So, and then you pick up on some things like, hey, they're hypersensitive about this. I think there's some other things going on. Let me ask a question this way or that way, or maybe not this visit, maybe next visit. So instead of like, hey, see me in 6 months or a year, hey, I want to see you in a month just to see how you're doing. And they may not know it's medical, but you're really just checking in with them and seeing how they're doing, because you don't want to then refer them or referring you to therapy or social work. People go on, it's a red flag for them, like no way, social, especially like things when you have abuse, where you're suspecting abuse and there's children involved. Anytime you say something about social work, they think that they are going to have their children taken away if they express that, I feel depressed or I feel this. So it's important to assess the patient mind, body, and somewhat soul to see where they are. Mm-hmm.
Absolutely. Trust is so important between patient and provider. And as you were talking, I was thinking about a term that is often used in the healthcare space, cultural congruence, you know, and or cultural competency, and basically what you described in terms of, you know, having a provider that understands, you know, you know, in your background, and your culture, and, you know, your thought process can have, you know, significant impacts on someone's health outcomes. So, so yes, and Stacy, I want to pivot back to you, from your perspective with regard to food and nutrients. So you touched a bit, you in your earlier responses about plants and protein. And can you talk more about what foods or nutrients best support stress regulation, mood, hormonal balance, particularly for women recovering from illness or trauma?
Sure. Well, first, I'd like to say I personally believe that every single person is different. So, what is going to support one person's health and recovery may not support another's and may, in fact, even harm them. So, the first thing I would encourage anyone to do, if you do have a diagnosis or if you are in recovery, is to get a specialist, get someone who will review your testing, your labs, your history, your recovery, and take a deep dive into seeing exactly what we can pinpoint in your own body. But that said, there are definitely some things that we know just across the board will support stress reduction in your body, will support, you know, the things that we were talking about earlier, nervous system and all of that. So when we look at stress management, B vitamins are fabulous for that. So a B complex, a good B complex, and magnesium again, which I touched on because magnesium, as I said, is very calming. The B vitamins can even help us improve our energy. So and they're wonderful for helping to balance that stress overload in our bodies. Omega 3s and antioxidants are another place where I think pretty much, you know, to generalize, are good for just about everyone. So omega 3s, you're looking at things like fatty fish, like salmon, walnuts, things like that. And then antioxidants are found in the plants, which are, you know, your berries and your darkly colored foods, things like that. So I encourage everyone you know, we always heard as kids, eat the rainbow, but there's so much truth to that. You know, we get different nutrients from all different foods and they work synergistically in our bodies. So whenever I have someone with a diagnosis, I you know, after doing some digging a little bit, if appropriate, I encourage them to eat as many different colors in a day as possible, because then you're covering all your bases and you're getting all of these antioxidants and B vitamins and magnesium and all of these things in, so, because they're coming from all different sources. So, and I think also too, protein is having a moment right now. Clearly, we all hear about protein, you know, every 5 minutes. I don't think you can scroll on social media without seeing, you know, some kind of protein rich, you know, recipe, this or that, or hearing somebody talking about how you need, you know, 8,000 grams of protein a day. So we all know protein, but you know, all of the hype aside, protein is very important, as I said, for that blood sugar stabilization and regulation, which is so key because when our emotions are on this roller coaster from these sugar highs and crashes, it is very hard to manage stress under that condition or to regulate our nervous system. So protein really fuels that. It fuels that stabilization. It you know, blunts that effect of that peak and drop. And it's you know, as I said, it's having a moment, but for good reason.
Yeah, yeah. Well, I love that the both of you are emphasizing awareness, restoration, just mind, body, and spirit. I want to transition to everyday practice. And so, Dr. Wilson, what does it mean to help women see themselves as whole? So beyond symptoms or lab results, and how can they take ownership of their care journey?
Mhm. I would say, it's inseparable. It's inseparable. All of it is connected to be your whole self and to really be at your peak of wellness. So it's important for you to pay attention to all of those parts of your body to make sure that everything is aligned, because again, if you're not doing well mentally, like Stacy mentioned, it will disrupt your hormonal balance. It will weaken your immune system. You could work out all you want, eat healthy, but if you're not well mentally, it's going to throw everything off. So it's important that you care for your body. I always say to my patients that peace is part of your prescription. People love to throw medications at people or suggestions, but peace is part of that prescription. So that peace, what does that look like to you? I love what Stacy said. Like, she goes for her walk. It's life changing. I'm also taking notes. I want you to do that, because I'll tell you this, healthcare workers, we are the worst patients, the worst, the
Yes.
worst. So I feel like a big hypocrite. But as I'm getting older, I see the difference. I don't bounce back like I used to in my earlier 30s or my 20s. And like one wrong night, I'm like, oh, I'm down for 2 days. I'm down for 2 days to recover. But it's so true. But if you don't, your peace is part of your prescription. When you've done
Mhm.
everything else, you've changed your diet, you've gone to the doctor, everything is good, labs are looking good, yet you still don't feel well, something's going on. We need to look at your mind and everything, what's going on, and make sure that you protect your peace. Easier said than done, but it is part of your prescription. And sometimes you need to take people out of your life to to get that peace back, whatever that means. That's a whole nother discussion.
Yes. Peace as a prescription. I love that. Dr. Wilson, can
Yes.
you write me a prescription for peace?
Yes. I was
Got
going to ask
you.
her also. Would you be able to send that script
I
over?
will, with a 30 refill. Okay. You won't
Thank
have to
you.
even worry
Thank
how
you.
much it is. Yes.
Thank you.
Oh,
Yes.
I will run to CVS to fill that one.
Yes.
absolutely. Yes.
Yes. Yes.
So,
Yes. Mhm.
Stacy, sometimes, well, I would say oftentimes, overwhelm can creep in, and so what are a few realistic, accessible steps um, that we all can take, to nourish ourselves physically and emotionally without guilt or perfectionism?
I'm so glad you brought that up, because I think sometimes when we embark on a healing journey or a fitness journey, we get very caught up in perfectionism, and then that just in turn creates a vicious cycle, because that makes more stress, because now we're beating ourselves up for not having done the things that we were supposed to be doing, and or we didn't go for the walk, we didn't go for get to the gym, we didn't eat a healthy dinner, and so that in turn ends up creating more stress in our lives. So we need to first of all just remember, I always tell the patients I work with that we are looking for, not for you to be occasionally perfect, but we want you to be consistent. Okay. Occasional perfection does nothing. It is
Mhm.
your daily habits. It is being consistent with all the things that we have been talking about tonight. So just trying to habit stack, I think, is a wonderful thing. So maybe you start with a daily walk, just like we were
Mhm.
talking about. And then during that walk, maybe you add in some box breathing, and that starts to regulate your nervous system. And maybe during that time, you're listening to a devotion or a meditation or just simply praying. And so
Mhm.
now you've stacked three wonderful habits into that one walk time. So it's no more time, but you've now achieved three separate goals for your day, and that's a huge win right there. So I think doing things like that, where you can really get the most ROI on your activities, on your food. I think viewing it more as consistency and small wins rather than this occasional perfection. Nobody's perfect, none of us. So we've all been laughing about different things tonight. I think all of us would raise our hands as we
Yep.
we're all in the same boat here. You know, we all have our struggles, and you know, it's difficult even to sometimes I'll hear myself telling a patient something and I'll think, you know, you really you should really do that. That would be a great
Yeah.
for you. You know, and I
Hmm.
make a little note for myself. But I think that just trying to do things very consistently in small doses, you know, start small, baby steps. You know, you don't want to try and just do this massive overhaul of your diet and you know, I'm gonna go to the gym twice a day and I'm gonna, you know, eat keto and I'm gonna do this, I'm gonna do, you know, it's just it's not realistic, and you're not going to do it, and then you're gonna feel worse, and it's as I said in the beginning, it's gonna start this vicious circle. So small wins, consistency, habit stacking, and really just trying to pack the most that you can into a, you know, a finite period of time, because we're all very you know, under time constraints. And so if you can, you know, get 2 or 3 wins out of one walk, or you know, one meditation session or something like that, I think that that is a much better approach than trying to, you know, constantly be perfect and achieve perfection. I think that you will end up doing your body physically and emotionally such a better service by approaching it that way than, you know, trying to go all in and, you know, go big or go home mentality. It's just not, it's not typically the way to create lasting permanent change, which is really what you want to accomplish.
Absolutely. Consistency, small wins. And you've spoken so beautifully about self-awareness, daily practices, um, sharing some small habits that we can all use to start to
Yeah.
support health and peace of mind. Dr. Wilson, what any ideas? Do you have any ideas on from a clinical perspective? What are 2 small habits that women can start this month to support both health and peace of mind?
I would say start off small, but go get a checkup,
Hmm.
go get a checkup. You can start small, whether it's a mammogram, whether it's seeing your GYN to see where you are, even your blood pressure, because all those things matter. I would start off small by doing that and creating yourself maybe a kind of a peace practice similar to what Stacy mentioned, that journaling, that walk. Start to do those things, so you want to start practicing radical self-love in a sense, because our life depends on it, and especially like we have families that depend on us, and you want to be your best version of yourself for your family. Make sure you show up your best self. If you can't take care of yourself, how can you take care of others? I have 3 kids that depends on me, so I got to make sure I'm healthy and take care of myself mentally, physically, in every way, so that I am not um transferring some of my stress or whatever it is onto them, and or become a burden to them if I then develop chronic diseases where they have to take care of me, and I don't want that to happen. So it's something that we must stop, and I can't emphasize enough the importance of education and awareness, because it's preventative, and education is power. So the more you
That's
know.
right.
Right. And when it comes to prognosis with anything, earlier detection with everything, early intervention always have a better prognosis in everything. So go get a book, go get the girls checked out. Go get the girls checked out.
Yes, yes, yes. So as we wrap up, and this is our final question, if you could give women one sentence of encouragement to carry into the rest of this month, what would it be? And Stacy, we can start with you.
I would tell them that you absolutely can change the trajectory of your life, your physical health, and your emotional well being with your food choices, your lifestyle choices, and your exercise habits.
Thank you, Stacy. Dr. Wilson?
I would say the same thing. You're never too young or you're too busy to take care of yourself. And it starts now. Your life is worth, getting checked and having these tough conversations to make sure that that you're the best version of yourself. Again, knowledge is power. And if you don't like the answer, go to someone else. Advocate for yourself, go to someone else. Yep.
Thank you both for this powerful discussion. And as we close, I want to leave everyone with 3 takeaways. Know your body, trust what it tells you, and don't delay that appointment or screening. Second, nourish yourself. Feed your strength, not your stress. And third, protect your peace. If something doesn't feel safe in your body or in your relationship, reach out for help. Visit the Esther Institute website and social channels for more resources. And Reverend Tiffany and team will be back next month. It has been my pleasure to be your guest co-host. And thank you so much for joining us for this special edition of Breakfast at Tiffany's, Whole Health and Whole Safety. Have a great day.
Thank you.
Thank you. Thank you.